about the right length for her. If you had excessive swelling in and around the ankle, you can use these malleolar pads and put it like this, and you can, go on the outside and the inside, and then you can use your Artiflex over the top of that, and that'll press the fluid out of around these bony areas. Okay, she had those, what do you call them, chip bags, and those were just dense foam that she kind of put on the medial side of her calf, and again using to create a little bit more compression. She also, you see that little white tool she was using? That helped to break kind of an instrument-assisted soft tissue mobilization, just working on breaking down some of that fibrotic tissue. All right, but once she got that done, then she uses Artiflex. Artiflex comes in 2 different sizes, and this size is, no, this size is this size. I think it's 15. I think it's 10 and 15 centimeters, I think. Okay. All of these, from a home perspective, all of these products could be used until they fall apart. This can be laundered, hand laundered, and then kind of dry, so the patient will have 2 or 3 pieces of it. And even this padding, because I mean they're buying it, gets kind of pricey. This padding can be used until it, basically just falls apart and they can't use it anymore, and then they have to use some more. But you start here. Most patients that I've seen, I did not have to wrap their toes. Okay, her toes were very, again, fibrotic, and so you could wrap individual toes with some gauze like this, or you could use that Coban like she did. So you would have to wrap every toe, and you would do this actually first. So you'd wrap a toe and then come around the foot. Again, pretend that's not on there. And then come around to the next toe, and then to the next toe, and you would spiral wrap all the way up on the toes if they're swollen. Most patients that I see don't have excessive swelling in the toes, and so I usually don't wrap their toes.
Are you pulling that as tight as you can?
No, not at all.
Okay.
Padding is just laid on just for comfort. Usually there's excessive or extra padding around the ankle because it's bony. Once you get above the ankle, overlapping this Artiflex padding about halfway. There's no right or wrong way to put padding on, really. It's just nice. And you kind of want this lower leg to be kind of a cylinder. So if it's a little smaller here, then I put extra on, and then when it gets up into the larger area, then I don't wrap it quite so, don't overlap it as much.
Do they have to have their foot dorsiflexed while you do this?
Well, for the most part, you want them to be functional. I mean, most people don't walk around with their foot at 90 degrees, but they're not plantar flex. So somewhat in the middle is probably where I keep them. And for her, just like you saw in the video, we're just gonna, today when you're wrapping, just go up to the tibial tuberosity, okay? Most patients, I wrap the whole leg. Okay, so you would keep this padding going, put extra padding behind the knee, and in fact, I'll usually fold it 2 or 3 times behind here, just because, and sometimes even behind the ankle, because as they move, there's a little bit more irritation there. All right, so you'd wrap all the way up to the proximal thigh, and then your stockinette would, of course, be all the way up there. Okay, so it would take, a minimum of 3, sometimes 5 rolls of Artiflex to cover a leg. And again, most people don't look like Carrie when they have lymphedema, okay? They're going to have, a much larger leg. Now, the size of the wraps, as the lady was a little confused between her inches and her centimeters, but they normally are, they come in 6, 8, 10, and 12 centimeter wraps. This is a 10, this is a 6. We probably wouldn't even use, and I think that's all we have. We just have 10 centimeter wrap. But you would use most likely a 12 on the thigh, 10 on the lower leg, an 8 on the ankle. Normally this 6 is used on the wrist. All right, so this might be a little bit, but for her it'll probably work, okay? So you would start, just like we talked about with the sequential pump. Normally you want more wrapping, more compression distally, and then as you go up, a little less, okay? So I would start here on her foot, just proximal to her toes. And as I go around, I put a little dog ear here to start so that it doesn't, doesn't unravel. And then you're going to put 2 or 3 layers here, overlapping about 50 to 75% on each one. And you're trying to pull out the majority of the stretch, again, probably about 75% of the stretch. So think about there's no stretch, there's stretch, so pull and overlap. When you get up to the ankle, probably do a figure 8. Sometimes the heel will show, probably better not to have it show. When we need some, oh, never mind. Can you roll that tape down there? See that? No, actual tape. No tape. There you go. Can you give me a piece of that, pretty please? Thank you so much. No, that's good. Murphy's Law says your wrap always ends underneath, so you can't get it. It seems to be. So then, the first one started, just the second one. A lot of times in the class I went to, you notice I went around this way. They say every wrap you should switch directions. I'm not sure that makes a bunch of difference, but I'm going to start here. Now I'm going to try to cover up my whole ankle this time. I've never wrapped someone's foot or lower leg sitting down like the video showed. It doesn't mean that you couldn't do that, but I would feel a little uncomfortable sitting down. Say I've never wrapped a leg quite this small, so you're going. It's covering a lot more than I would anticipate it would. Tape, like in surgery, scalpel.
That one ended on top.
Ended on top. Murphy's Law. It didn't work that time. So now, again, I started first one here, second one there. Now I'm going to come back and start. This is probably the last one you'll need. When you're done, your wrapping feels like a cast. You don't want to wrap above the artiflex. The artiflex is there to help shape, but also for comfort.
What you like the little?
I'll take 2. I'm not that hungry. Or I'll take 3 scoops because I'm not driving. Where did that come from? Home Alone. 2 scoops? No, give me 3. I'm not driving. That's Kevin. That's a little long. You could probably cut that off. And here, like she said, you would take this and kind of wrap it on top, and then you could tape all the way around that, and you could tape all the way around this as well. Okay? How you feel?
Very uncomfortable.
Very uncomfortable?
It's very stiff.
Very stiff, but you should be able to move. Move your ankle. Okay? So remember, we have these short stretch bandages give us resting pressure. So even when she's sleeping, there is some compression there that's helping, but it's not as much as when she's walking or active. And we have that active pressure. Okay, that's even the working pressure is even greater. So you would encourage your patients to leave this on until they saw you again. Normally, in the beginning, that's 24 hours. Sometimes it's 48 hours. If they shower, then they have to cover this up with a bag. If take a bath, leave this leg out, and make sure that if it's too tight, like the video showed, I have had patients that I've got it on too tight, it just hurts, so they have to take it off. That really sets you back. Think about it. If they take it off within 2 or 3 hours of you putting it on, and they're not supposed to come back for 48 hours or whatever, then you've instructed them to call you so you can get it back in sooner. Because we need to get the wrapping back on, just a little less compression. But they leave it on for 24 to 48 hours. You come back, and then you would start the treatment. So you take it back off, you get a remeasure, clean them up, have them go through their exercises, put on lotion, and start over. Put your stockinette on, your Artiflex, and the wraps. Okay. Normally I have 2 sets of wraps. They wash one, wear one. Literally, when I take the wraps off, we put them in a bag and I give them to them. And then the next time they come, they bring those wraps back that have been washed and dried. Again, have to hand wash them and hang them somewhere to dry. And then we roll them up and we put it back on. I take the old ones off, give them back to them, and they just keep that process going until we're done. This normally takes about 3 to 4 weeks to get them down to that final measurement. And once they get to the final measurement, I order the garment or I select the garment, and in the process of that 3 to 4 weeks, you're doing a lot of patient education, making sure they know the whole process of manual lymph drainage, and that they're going to have to do that on their own. Okay, so self-manual lymph drainage and self-bandaging. They'll bandage at night, wear their compression garment during the day. Bandage at night, wear the compression garment during the day. We've introduced intermittent compression pumps. Patients that can't reach their feet, patients that just have no ability to do manual lymph drainage on their own or to wrap on their own, then they can use the intermittent compression pump, typically morning for an hour, evening for an hour. But they still have to wear their garment, their compression garment during the day. You've got to teach them the active exercises to help move the fluid as well. Okay. Lifelong management. Your job is to teach them, help to get that phase 1. You're heavily involved in phase 1, helping them reduce their swelling so we can get them in a management garment. Okay, remember that compression wraps put on correctly help to reduce, whereas compression garments just help to maintain. Whatever size it is, they put it on, it's probably going to stay relatively the same size. Remember, the wraps and the garments only last about 6 months, maybe a year. It's good to have 2 of those as well, 2 garments, so wear one, wash one.